Scott is going to update us on some of the changes in ISDH this year. And then Lisa Harrison is going to tell us everything that we need to know about the new software-based inspection report. So we're looking forward to both of those. Scott?
Thanks, George. That's a tall order, Lisa. Everything in an hour. I don't know. That might... This thing keeps getting moved. George, I think you're doing it. All right. So everybody should have gotten one of these handouts. Everybody hear me? Okay. Okay.
I need a handout.
Sorry for the size of these. This is what happens when you ask somebody to do something remotely. I was trying to do, the regular handouts, so they're really big, so you can see them. So that's good. But it was a bit of a waste of paper, so I apologize for that. So basically, I want to just do an update of our program. Some things have been going on. No way can we cover everything. And then Lisa's going to do a demo of CodePal. Some of you have seen that already. Some of you have not. And I want to do my updates, and I'll lead into that presentation. And I'll hand it off to Lisa here in a few minutes. Okay, so as you know, one slide that I don't have in here is a slide about the update of the food code. That many of you probably will want to know what's going on with that. I announced last year that we were going to start the process of updating the food code, and we did. Dr. Almanza from Purdue did her sabbatical with us last year, and she did a lot of prep work for us. But then we got stalled because of the Super Bowl, because of the Conference for Food Protection, because we moved, State Fair, outbreaks, IEHA, and here we are. Okay, so nothing's been done on it much, but we are planning to move on it. So there'll be more to come soon. So just hang tight on that. So this is our new location. Most of you know this by now, but we're in with entomology and the indoor health guys at 2525 North Shadeland. So if you've been to the entomology lab for any reason, we're right there with those guys. So feel free to stop by anytime you want to. But if you're looking for a particular person, you might make sure we're there before you come in. Hate to miss you. One item I wanted to announce was that we finally filled our food defense coordinator position that had been vacant for about 5 months. Previously been occupied by Sarah Popovich. That went to the Epidemiology Resource Center. And so I got that filled. Mary Steicher was a great find. Some of you know her. She used to be the IEHA treasurer. And she's been around for quite a while, has a wealth of experience both in restaurant, hotel, institution management, and nuclear physics. I don't know how those go together, but she made it work somehow. So that's Mary's picture. She's on vacation, otherwise she would have been here today. So she extended her apologies for not being here. Okay, as a result of this year's legislature, we had a couple things that impacted us. House Enrolled Act 1298 happened, and that created some additional authority for the Indiana State Police to deal with food transport vehicles that are in violation of state food codes. It's the first in the nation for anything like that. There's no other states that have that, where the state police troopers have authority to detain trucks based on our food rules. So that's a unique situation. And that's just the Indiana Code, Chapter 8, where that was put into. This thing is moving on its own. I don't know why it's doing that. George, keep an eye on you over there. Okay. So anyway, as you know, we developed and sent out a guidance document on how to inspect trucks. We developed an inspection report for you to use. We had to do this for the state police too, because of the new law. We had to do training for them ahead of time. Even though they had been working in this, they wanted more formal training, and we provided that for them. Okay? Okay, so this started several years ago when Travis Goodman and Mark Maddox were the food defense coordinators. It was a state police and ISDH initiative. And what really made this click was when we finally provided the state police trooper those infrared thermometers. Once they had a tool that they could use, everything changed. It was a game changer. And like I say, I've told a lot of people, It helps that those things kind of look like handguns, okay? Because they like to use those, and it works pretty well. But they've gone crazy with those things. Some of you had that experience, so they keep asking for more, but we don't have any more funding, so they need to buy their own. But obviously, transportation has been a weak link in the farm to fork continuum. It has not been looked at by most regulatory people at all. And we're one of the few states that have an organized, ongoing approach with doing this. If you've been involved with this, you've seen some that did not have refrigeration units running or operating for a variety of reasons, improper storage, cleanliness, cross-contamination, a few things like that. There it goes again. I don't know why it's doing this.
It's on a timer.
I didn't put it on a timer, but okay. So anyway, this is just a photo of a detail we did a few years ago over in Wayne County. Some of the Wayne County folks and then some of the state police troopers with Ohio. I always like to say it's good to be on the same side as those guys, you know. They're a lot bigger than I am. I want to be on their side. So we do these organized details occasionally, and you're invited to participate with us on those, and some of you have done that. How many people have worked one of the details with our folks? Audrey, I know you have. Anybody else? Richard? Way back there in the back. Dana? Okay. So we do those, and then we also do, the state police do the pullovers. Those are the ones that we never know when those are going to happen, okay? And you might get called out on those. And just so you know, we provided the state troopers with the after-hours contact numbers for the environmental health specialists for the county health departments, because they needed to know that in order to get a hold of you guys if they need some help. Here's some just quick numbers. We don't have any 2012 stats in here yet. Like I said, the position was vacant. Our food defense coordinator does this. So once Mary gets back into the program, more established, she'll be putting in the 2012 numbers. But you can see we've done quite a few truck inspections, 388, and that's not including a lot of the pullovers that you guys have been involved in. We would like, anytime you get involved with one of these truck inspections, to eventually send the report in to Mary, okay? We're trying to track these numbers to see what all is going on. So please do that if you can. And I'm going to provide this to Christine, so I guess this presentation will be available later. So because of the need for training for you guys, Don McDevitt and some others hosted a training seminar up in Northeast Indiana earlier this year, and it went over really well, very successful. So we decided to replicate that in multiple places around the state. And so Lisa Harrison and Andrew Miller and then whoever's in that area from our staff will participate in those. We're going to have the state police there to help in the presentation. And these are the locations we're going to have this. There'll be a formal announcement coming out real soon on this, because I know it's short notice. But if it's in your area, we'd really like you to attend. Make note of these dates, okay? And then I teased George at lunch. He stole half of my slides for his ISDH report, so apologize if you're hearing this again. But just so you know, we are, there's a need for us to do food sampling training. We're seeing enough turnover in the local health departments. We're seeing samples coming in that maybe weren't collected quite right. The paperwork wasn't quite right. Shipping wasn't quite right. And this is something we used to do all the time. Every year or so we did trainings and we've gotten away from it, so it's our fault. We need to get back and doing that. And so we're going to be providing that training with ISDH laboratories. A similar deal, we're going to go around the state, maybe do 5 or 6 of these. So more information to come on that later. But it'll be over the late fall and winter. All right, so another bill that happened this year was 1312. And that required us to write a rule for this new bill. I'm not sure why, but we had to do it. It was mandated in the statute. Basically, it just exempts small producers of poultry up to 1,000 birds per year from the regulatory requirements of inspection for the processing. Okay. We required that in the food code. We closed that gap. This is an old USDA exemption. It's been around for years. We closed that gap, but now it's been opened back up. So the legislature decided they wanted to have that. So essentially, these people can, process their birds on the farm, sell it at farmers markets, roadside stands, or on the farm with no inspection on the processing. Now the product does have to be frozen, and in the rule we define that as 28 degrees or less and hard and rigid. Okay, then all the rest of the HBV requirements apply to this, the labeling and that kind of thing. So the rule was preliminarily adopted on 9/12, just a couple weeks ago. Now we're going to have a public hearing on it probably in November, early November, around in there. So it's a pretty simple rule, about 2 pages. We need to get that out to everybody so you can take a look at it though. The Food Safety Modernization Act that was passed in 2010 gave FDA a lot more authority, sweeping changes to the FDA, most in 70 years. They were charged with writing new rules such as the produce rule, such as the transportation rule, and 3 or 4 others. They've gotten those done. They're all being held up in the office, their OMB management budget. And until they get through that process, nothing's going to come out of it. But when they do, it's going to be game changers for a lot of our industries. It would have been helpful to have had the produce rule in play now because of what we went through recently with the salmonella outbreak. Another change that happened in state law, I think it was a year ago, 2 years ago, it took ISDH authority out of having to inspect prisons on the hospitals. There are a lot of hospitals, prisons, Department of Correction facilities had infirmaries that are classified as hospitals. They're no longer inspecting those, and now they're being done by third-party certifiers. So far, it seems to be working. The thought was maybe we would have to take them over, and I didn't want to have to do that, so we're trying to work through that process right now. Some things have been happening with food handler certification. There's a new accredited testing organization called 360 Training. That's pretty new. Just as of the last CFP board meeting, they have gotten the ANSI certification and now the CFP certification. It's not really available in Indiana yet, but it probably will be. So it's going to be a 4th testing corporation that will provide these. I really don't know much about them. Sharon's been working more with them than I have, but they are approved. And then Restaurant Associations published the next edition of their Serve Safe book, the 6th edition. Then something that happened this year, we had some calls from you guys about this related to this new Serve Safe certification, being confused with the food manager certification. So what it amounts to is that if you have the ANSI and the CFP logo, like this one here, it's considered as meeting our state code and the CFP requirements. If it's just got the ANSI, it means it's ANSI certified, but it doesn't mean it meets our code, okay? And there's nothing wrong with this certificate of achievement. In fact, we would encourage people to get it. Any kind of training is good for food handlers, okay? Just don't get it confused that it meets the food manager certification or our code. And we put out a notice on that, so you should have seen that. Some enforcement cases we've been dealing with. The big one was Union Broker, HK Trucking, UD Service. It's all the same company. This is one of the trucking companies, one of our Asian food distributors we had a lot of problems with. Went all the way to court. Judge Serto read them the Riot Act and basically fined them $100,000 and a 30-day jail sentence for the owner. Now, it was suspended pending further compliance, so he hasn't had to serve that yet, but he spent a ton of money in attorney fees, both his and ours. So, but so far we're seeing a lot better compliance. Sometimes you have to do a heavy-handed approach to deal with some of these folks. If you were here last year at the fall conference, Sharon did a great presentation on Copper Creek Farms. And I apologize that we haven't been able to get much done with that over the year, but we've been kind of busy. But just a couple weeks ago, We served a search warrant for this facility and did an inspection, and we are now taking them under our inspection control, and we're going to start working with them to seek compliance there. So Stan, if you're in here, Stan, you back? Oh, he's in that other talk this afternoon. But he served that. Bo was there. State chemist was there. State Ag Board. More to come on that. And then recently we had to do an emergency order to shut down a company called Ocean Fresh Seafoods. And they are still shut down right now. They're working to try to get it into compliance so they can get back open. So it's significant when we have to do a cease and desist order. And the one thing that's really been monopolizing our time lately is this outbreak. How many people heard of the Salmonella typhimurium outbreak in Indiana? Everybody should be raising their hands, right? Okay. Well, you know, these kind of things start out in the EPI program. We don't know what's going on for a long time. Sarah, who, bless her heart, left our program, went into that job, is still dealing with this. But she did a good job of putting the pieces together and started identifying a cluster. And then she started working with Kentucky, and then lo and behold, we have a lot of people sick, okay? So it turns out there's this typhimurium, okay, that was the culprit. And there's a PFG test that's done that creates a pattern, a DNA fingerprint, okay? This particular one was 0324, okay? And based on the clinical specimens from the ill people, and then lab samples that we collected, FDA collected, environmental samples FDA collected, we connected the dots and had matching serotypes, both on the farm and to the ill patients. And so we identified it was Chamberlain Farms in Owensville, Indiana, Gibson County. They did a recall, okay? But we weren't convinced that was the only source, so we kept looking. We're still looking. Okay, we did some other testing. We found Salmonella Newport 0149 on some watermelons. It's not related to an outbreak, but still Salmonella. FDA's official federal policy is any Salmonella on any kind of ready-to-eat produce is considered adulterated in the prohibited act under the Federal Food, Drug, and Cosmetic Act. So that's been tough for us to come to terms with because it's on the ground. You know, it grows on the ground. So just to show how convoluted this is, you know, we found Salmonella in another cantaloupe, but it's a different kind of Salmonella. We had a couple cases matching to this pattern, but nothing confirmed. FDA's got a Salmonella Newport with this 4014 pattern, but no cases in Indiana to another farm. You know, it just gets really convoluted really fast. Okay? In Indiana, as of yesterday, we had 33 total cases. What CDC did, they combined the typhimurium cases with this Newport 0807 pattern into one outbreak. And so that's why the numbers jumped up a little bit. But Indiana, we had 24 of the typhimurium and 9 of the Newport. But Kentucky had 3 deaths associated with this outbreak. I mean, it's severe. So last week, FDA came in with 8 people to Southern Indiana, and myself and David Schmidt were down there all week with FDA doing a complete environmental assessment, different than the one that was done during the outbreak, just like the one that they did at Jensen Farms in Colorado last year. Okay, it was a very interesting process. I'm glad I stayed for that. We took samples from soil from the melon fields, additional environmental samples, additional cantaloupe samples, did a lot of interviewing, looking things over. No results back yet on anything. They just were collected last week. So there are 3 teams. I've never walked 500 acres of melon fields in my life in a day and a half. That was interesting. Even had my car in one of the fields driving through it. But the thing about it is, this is significant. This is only the 3rd time FDA's ever done this. It's a special process that they have just started using. So we'll see what comes out of all this. But at the Horticultural Congress last year, I spoke to these growers, and Sharon, you were there, and I said, you don't want to be the next Jensen Farms. We don't want one of those in Indiana. and look what happened. Now we've got our own, Chamberlain Farms. Mr. and Mrs. Chamberlain have been devastated by this. They are distraught. Just the nicest people you could ever know. But, you know, they're having to deal with this now. So as a result of this, I'm getting 2 new positions. And I've always, how many times have I said that you can't get new positions unless you have bodies? Well, we got bodies. So now I'm getting 2 new positions to do nothing but work with the farms, okay, on produce issues. So we're in the process of creating that right now. Hopefully by the end of the year we'll have some movement on it. But that's the good news, so that we can spend a lot of time working with these folks. So that's a positive thing that came out of this. Another thing we're working on is a Rapid Response Team initiative. FDA just released their new Rapid Response Team Best Practices Manual just last week. And we're trying to get this established in Indiana so that we can do a better job of quickly and more effectively identifying these events and dealing with them in a more expedient manner. Okay, so it's primarily going to be between food protection and EPI, but you guys may have a role in this too. So more to come on this, okay? And we've got some good news on grants too. FDA awarded us a new grant. Well, to just go to the top, we have our Food Safety and Defense Task Force grant. We're continuing. Okay, so we still have that. We're still having the task force meetings. Okay, and we have a conference grant to help us host those and pay for those. We entered into a food inspection contract with the FDA that they pay us to do some inspection work now, so that we would have access to these other grants. You know, they kind of held us over the barrel. We had to have the contract in order to be eligible for these other grants. So just last week, we got notice that we were approved for the Advancing Conformance with the Voluntary National Retail Food Regulatory Program Standards grant. That's the retail standards that we keep talking about, okay? So what it means is I'm going to be able to hire a dedicated person to do nothing but that, to help our program get in compliance with it, but also to help you guys too. They're going to be a resource for you guys going down the road. And this is 5 years, so I got them for 5 years. Same thing on the Manufactured Food Program Standards grant. That's another 5-year grant, and I'm going to get a dedicated person for that. Second year, a dedicated person for training and auditing for our program. And third year, a Rapid Response Team coordinator. So that's good news. And some funding to advance CodePal too. We got some additional funding for that. That's 5 years too. Okay, so along with the standards, you might have heard us talk about the Indiana State Health Improvement Plan, or ISHIP. Okay, this was developed a year ago, April. The state's required to have a state health improvement plan on file and updated every 5 years. So it just got updated. Food safety is one of the 6 priorities. How many people have looked at this? It's on the main web page of our agency. It's always on the front home page. Not very many. Well, yeah, I know you have, Katie. So you need to be looking at it because it has relevance to what you guys do. This was created with an executive committee. When this was done, they had local health department people on it. You need to be using this thing to help your own programs. Okay, you are a part of it. Okay. And it's all about incorporating these standards into your programs. Okay, it goes right along with these standards I've been talking about. All right. So, yeah.
This is on the Indiana.gov, and then you go to food program, or?
No, just go to the ISDH website homepage. What is that?
Google.
Well, Google, yeah, Google. But it should just be isdh.gov/ISDH. That would get you there. There may be another way to get to it. Right in the middle, you'll see State Health Improvement Plan. And it's a big document. And there's other plans in there, like the State Obesity Plan and some, tobacco, anti-tobacco, and that kind of stuff. But food safety is one of those pieces. Okay? And it's got EPI stuff in it too. It's all very comprehensive. So we've got the state agencies engaged in trying to meet these, like the BOA and state chemist and egg board, they're all participating in this, but we need the local health departments to be active participants in it too. So just take some time. Don't, yeah, read the whole thing, but focus on the food safety priority. It's not an overly large document. Okay? But CodePal, that I'm going to get into now, lends itself to helping you meet the standards, okay? Because we've designed some of it to be risk-based, and the standards are all about risk-based inspections. And this will help you get in compliance, at least with parts of the standards, by using CodePal. Okay, so how many people have seen a demo of CodePal in your departments? A few? Okay, so you have some familiarity with it, okay? It's created by a company called Cybatech out of Illinois, used by fire and building code officials. It's been adapted to food safety, so we're the first ones to use it in food safety. Very similar processes as fire and building code inspections, okay? We've been using it live since March of 2011 in our program. We added IU. Graham and Shane were the first ones. They're still kind of getting their feet wet with it. Ball State's been added. Purdue's been recently added. You probably haven't gotten too far with it yet, Jennifer. And the reason we got the universities involved was because we have MOUs with them and we needed to provide them this tool, so they were the first ones to get it. Jeff just got it recently, Davies County. Probably still early, with that. And then we plan to still get Delaware County by the end of this year, okay? Our goal for this year is to get 5 organizations using it, and that'll get us our 5. And then going forward, we're going to add more. The thing about CodePal is, it may not be the only tool out there. That's fine. We would encourage you to use it because we can all share our data then. If you got your own systems, it's going to be hard to share data, but we're not telling you have to use this. But eventually you're going to have to figure out a way to meet the standards if you don't use it, and we still want your data. So it'd just be easier to use CodePal, okay? There's no permit cost for it or license cost. We've paid for all that with state funding, so there are no annual license fees or anything like that you have to get. We've taken care of that. It will produce permit fees and produce receipts, or process permit fees, produce receipts. The best thing, though, is the shared read-only data. So I can look at Chris Thomas's data. She can look at ours. I can't manipulate her data, but we can all see it.